morning, Miss Mary. My name is Kishma. I'm your CNA for today. So I was told that you need to go on the bedpan. Okay, so before I start, let me go ahead and just wash my hands, okay? Then I am going to grab my supplies and we'll go ahead and get started, okay? So let me grab this table. Put this right here. And then I'm going to grab my supplies. Okay. So I usually put something on the table to kind of cover it, because when you're taking the bedpan out from underneath the patient, you do not want a dirty bedpan on the table, especially that's where you're eating. We'll leave this right here. And also I am missing a pair of gloves, so I'm going to grab some gloves, okay? Okay. So let's get started, Miss Mary. So let me go ahead and put my gloves on first. Okay, so what I'm going to do is pull your blanket down a little bit and just expose you a little bit so I can get the bedpan underneath you, okay? So I'm going to get this blanket down a little bit. Okay, so I'm going to use this towel here for privacy. So I'm going to cover you up, okay? Pull this up just a tad. And then I'm going to turn you over, okay? As you can see, the rail over there is up. So I'm going to ask Miss Mary to turn on that side while I put the chuck underneath her, okay? And this is to protect the bed from getting soiled. Okay, so Miss Mary, I'm going to ask you to turn on 3, okay? So I'm going to bend this leg. And then I'm going to ask you to hold that rail over there for me, okay? Take this from you. So if you can hold that rail over there. And 3, 1, 2, 3. Thank you so much. Okay, get your arm. Get this underneath you. Okay, so I'm going to also place the bedpan while I'm back here, okay? So the white part of the bedpan needs to go on the buttocks area. Okay, so Miss Mary, I'm going to put this right underneath you like so. And on 3, we're going to come right back, okay? 1, 2, 3. Great job. Let me position you better on this bedpan, okay? Okay, is your hand over here secured? Okay, great job. Let me cover you back up. Okay. Thank you so much. Okay. So right now, I'm going to go ahead and take my gloves off. Okay. So pinch and pull. Roll it up, 2 fingers under. Gloves off. Put this into the trash. Then I'm going to wash my hands. Okay. So Miss Mary can't use the restroom laying flat. So I'm going to go on the other side of the bed and raise her up. So we're going to get you up, Miss Mary. Get you into a comfortable position so you can use the restroom, okay? Is that good for you right there? Yes. Okay, thank you. Okay, so let me come around on the other side. I am going to push this closer to you so you can use your tissue. So here's your tissue to wipe your bottom. And here's your wipes to wash your hands, okay? Also, I'm going to provide you with your call light. If you need me, you call me, okay? When you finish, just call me. So before I go, let me make sure this bed is locked and it's in the lowest position. And we'll wash my hands again and just step out, okay? I'll be right back. Mary, I'm back. I heard that you're finished using the restroom. Before I start again, let me go ahead and wash my hands, okay? Let me wash my hands and let me lay you down on this so I can pull that bedpan out, okay? Okay, let's get your head down. Okay, so to put the bedpan under, she must be flat, and to take the bedpan off from underneath her, she must be flat. Okay, let me me wash my hands again. You can wash your hands as many times as you want. Now I'm going to get another pair of gloves because I got to take that bedpan from underneath her. Okay, Miss Mary. Let me put a pair of gloves on. And do the same thing here. Okay, how are you feeling? You feeling okay? Okay, great to hear. Okay, so you finished using your wipes and the toilet tissue. Okay, great. So I'm going to move this light from here. I'm going to pull this down again. Keep your covers as much as possible. So I'm going to turn you like the last time, okay? So I'm going to bend your knees. And I'm going to ask you to hold on to that rail. And on 3, we're going to go. 1, 2, 3. Thank you so much. Okay, so here I'm going to put this, and also I am going to move this away from me without spilling anything. So on 3, we're going to come back. 1, 2, 3. Thank you so much, okay? Yes, so I'll come back and get that from you. This goes into the trash. Okay. This, of course, it has contents in there, so it goes directly into the toilet. I am going to rinse it. Goes directly into the toilet. You can rinse it again if there's more stuff in there. Goes into the toilet. Then I'll dry it. Okay, let me put this right here. Of course, this will go directly into my dirty area. That's my dirty area right there. What's ever left, toilet tissue, wipes, goes into the dirty area. I'm going to clean my supplies up. Here goes away from me. Okay, Miss Mary, I'm going to put your legs down. And I'm going to pull this off of you and cover you up a bit. Just to get you covered, okay? So both of these here go into the dirty laundry. Okay, so thank you so much. While I do that, I'm now going to take my gloves off. Of course, pinch, pull, 2 fingers, under, pull. This goes into the trash. Okay, at this point, I'm going to wash my hands. I'll turn to the evaluator and say I will wash my hands at this moment. I'm going to move everything out the way. Okay, Miss Mary, how are you doing? Okay, you doing okay? You feel better? Glad to hear. Okay, so let me cover you up a little bit. And I am going to give you the call light, okay? I'm about to leave the room, so if you need me, you can call me, okay? Before I leave, let me make sure the bed is locked and it's in the lowest position, okay? Is there anything else that you need? Okay, you're good. Thank you so much, okay? My skill is complete.